Today is our 21st live event on iGeriCare. Just a reminder for you, you can send in your questions on Facebook if you're watching through Facebook, and you can use our chat bot if you're watching on igericare.ca/events. This is one of the earliest issues that faces many people living with dementia and their families, and can be a really tough one. Maybe our usual format today, we'll start in with a brief presentation talking about some of the issues of driving in dementia, and then we'll try and get through everybody's questions. We'll be making a recording of the session as well for people to watch later. So why don't we start in your practice, Richard, just tell us a little bit about the importance of driving for people and why this is such a hot button issue.
Yeah, that makes a lot of sense. I mean, as you can imagine, what do you rely on driving for in your day-to-day life? Pretty much everything. And that includes practical things like going and getting your groceries. It involves things like, socializing. So being able to make it to your friend's house, see your grandchildren, see your friends, enjoy your hobbies, whether it's, golfing or fishing. It requires requires driving to do many of those things. And so when people lose the ability to drive, there can be a huge sense of loss and a sense of losing your independence. And so there can be a lot of grief around that too, because you've lost part of your identity and part of what's made you an adult and participating in all those activities for so many years. And so the other side of it, it's not just the practical aspect of navigating through the world. It's also many times the grief and sense of loss, and sometimes social isolation or potentially mood problems like depression that can accompany the loss in driving. So it's a really, really big issue for people.
I think we obviously we have to respect everybody's circumstances are very different. But I think this is one of the areas too where, while it may impact all people living with dementia and their families, it's definitely there are definitely differences whether you live in a big city, have maybe family nearby with access to public transportation, can maybe afford taxis or Ubers or things like that, versus people who might live in rural or suburban areas where the automobile is an even more central part of life, I think is true.
I think you're right. It does speak to the individual nature of everybody's journey. And sometimes some people don't use a car at all and have never used a car and walk locally to do everything that they're interested in, or perhaps they use a bicycle or something like that. So you're right. But for those who do drive, definitely a big issue.
So let's talk a little bit about what we do know about, I guess, the medical and the research literature about people with dementia and driving.
Sure. So people that have dementia do continue to drive. And I think that's one thing. The first thing to note is that even if people carry a diagnosis of dementia, it doesn't mean that they're unfit to drive. We break it down into mild, moderate, and severe cognitive impairment or memory and thinking problems based on the stage of dementia that somebody might be at. And certainly at the early stages, if somebody has mild cognitive impairment or mild dementia, they may be able to drive safely. And then when things get to the moderate or severe stages, generally when people are having problems with multiple instrumental activities of daily living, such as shopping or finances or cooking, or if they have even one basic activity of daily living, they can't get dressed anymore. That's when people really start to get flagged. But from a scientific point of view, people that have cognitive impairment are at a much higher rate to get into collisions or have accidents, in particular around intersections as well. And so I think that's the challenge, though, too, from a scientific point of view, is that there's no hard and fast cutoff from any pen and paper test that we can use to say, well, you failed this one particular test. It's absolutely a no-go. There's no one particular symptom that somebody might have that says, absolutely, it's time for you to stop driving. So it's a bit complicated. But even amongst studies where they're looking at people that just have a mild dementia, between 15 and 65% of those people, when tested in an on-road setting or in a simulator setting, would have failed those tests. And, as you can appreciate, that's quite a wide range,
Yeah.
depending on the study that takes place, which also speaks to the lack of clarity or the lack of ease with which we can approach this. It's a very complicated issue to try and address, and kind of requires us to look at the symptoms that people have with respect to their memory and thinking, other medical issues that they might have that can impact their driving, how they're doing day to day in their functional capacity, looking at their cognitive tests as well, and physical exam to see things like a reaction time, or see if they have any other neurologic illness that can impact it. So,
That's great.
We're looking for that comprehensive approach.
We'll have a look at some of the specific ways that dementia impacts one's ability to drive in a second. But I think that's a great point, that there's a lot of different factors, including dementia, other medical conditions, medications that also impact what we refer to as the medical fitness to drive. So those factors will, many people with dementia are older adults who may have other medical conditions, may be on other medications. And those are some of the things that also have to be factored into the assessment of a person's medical fitness to drive. Let me put up.
I think some examples. Some examples for that might be somebody that has a heart rhythm problem that causes them to pass out intermittently, or somebody that's had a large heart attack and hasn't received appropriate medical therapy, or people that have a seizure disorder. They're all things that aren't directly related to dementia that can also impact somebody's fitness to drive. So those are just a few of the conditions.
So when we talk specifically, though, about some of the ways in which dementia specifically may impact driving, maybe speak to a few of these particular ones as well, because these are some of the things that we would ask about when the person living with dementia and their family are there, and look for on physical exam or some of the other tests that we might do.
Yeah, I think when people are in my office frequently, I'll ask them to actually imagine what it takes to drive, because I think we take it for granted in cognitively intact individuals, just how much information is coming at you while you're driving. So, you're trying to stay in a lane, you're using a turn signal, you're checking your blind spot, you're paying attention to street signs, you're paying attention to street lights as they're changing. You need to react very quickly to new events. If a car pulls out in front of you, or a ball rolls out into the road, and all of that you're doing while you're navigating in a larger environment, right? So when people start breaking it down and thinking about that, it really requires your memory, your ability to process information very quickly, your ability to multitask as well. We've mentioned visual spatial function and the ability to maintain orientation and understand how to navigate. So as those cognitive capacities diminish, then your ability to drive safely diminishes really quickly as well. Some of the other things here. So, go ahead. Sorry.
Yeah, people sometimes call it. We've talked about the ways that dementia might impact executive functioning, where you have to sequence and orient and abstract and make decisions and plan, multitask. And people sometimes call driving kind of like a super executive function, because it brings together so many cognitive and motor tasks in one, or a super instrumental activity of daily living, because there's just so many different elements on the go simultaneously, where reaction time is also a key thing. It's not like you can sort of take your time and make your decisions.
Absolutely. Some of the other things mentioned here. So Sometimes with neurodegenerative illnesses, you might have stiffness of your muscles or tremor, problems with coordination. So that's not just related to the cognitive processing, but the actual physical ability to move. And oftentimes, as you age, you have poor vision and poor hearing, which also impact your ability to take in your environment around you, to make appropriate judgments and react to things that are taking place. And then finally, some of the more emotional reactivity or lability. Somebody cuts you off or pulls out in front of you, and you get upset and emotionally reactive. You're less likely to make appropriate decisions when driving, and might have rash decisions. And there's something to do with impulsivity as well. So you might just have a reflex reaction instead of being able to kind of inhibit that response. It just will happen automatically. And so you might do things less safely.
Yeah, people, I guess, go ahead.
And finally, just this alertness here. So being drowsy or sleepy. So, for instance, dementia with Lewy bodies, people have fluctuations in their level of alertness. And so if you catch them at a downtime while they're driving, then certainly it's going to spell bad news. So, and alertness obviously is associated with a lot of the medications that people might be taking as well.
And people who may have sleep disorders as well. So
yeah,
we'll come back to this a little bit, but actually maybe it's worth walking through a few of these things. This is a mnemonic that healthcare providers sometimes use as the things that are looked for in the assessment of medical fitness to drive, in particular in people living with dementia. We've talked about some of the cognitive things, the acute or fluctuating illness, and again that adds complexity, doesn't it? If things like delirium or sedation, they might not be there all the time, but if they occur at a particular moment in time while the person is driving, that can be a fatal situation. You mentioned some of the nerve or muscle diseases or neurological effects. Diseases like Parkinson's disease may affect cognition. They may also affect and will affect motor skills and motor speed. And the medications used may also cause symptoms like hallucinations that could impact vision and concentration. Many of the medications, we could spend an entire day just talking about medications that could impact driving.
Absolutely.
Because there are so many, and we've talked about them in other live events around things like medicines that have anticholinergic or side effects on memory or level of alertness or concentration. The in-car experience, I think that's something when we're talking with families, we're often asking them to share a little bit more about their in-car experiences with the person, and vision and alcohol use. I don't know if was there anything else about these that you think is worth highlighting?
Yeah, we'll probably get to it a little bit later on, but just in terms of the in-car experience, a common question that people are asked that really cuts to the chase is, we can talk about theoretically all these different neurologic symptoms and stuff, but when you ask somebody, would you let your son or daughter drive in the car with this individual, right? That really cuts to the chase. Sometimes they may minimize even themselves driving.
Yeah.
But you picture like a grandchild in the car, and that's like, people will be a lot less likely to hide those symptoms, I think, in that case, or hide the problems that person might be having with driving.
You're absolutely right, too. I definitely have had the experience clinically where the family or friend care partner will reluctantly continue to be a passenger in the vehicle. They have misgivings about the person's driving. I think in some cases there may be a longstanding gender roles or even just the pattern in the relationship where the spousal care partner allows the person living with dementia to continue driving, but may feel a bit unsafe, continues to do that, but basically would not allow a grandchild to go in the vehicle. So I think sometimes it's just so hard to have the open conversation about it that they elect to continue chancing it, even if they feel a bit unsafe.
And I mean, just a note for the caregiver partners here. So most physicians are happy to take calls from family members outside of the appointment as well. And so if you're having these concerns but don't quite feel confident enough or are fearful because of what the reaction of the person with dementia might be, you can always schedule in a conversation before your in-person appointment or an appointment aside from the time that you're scheduled in for the person with dementia's assessment.
I'm gonna actually jump, because that sort of brings up a good point about what, if you're a family and friend care partner and you have concerns, as Dr. Stramko's saying, you can call and voice those concerns, leave a message for the healthcare team or the physician. Some people might send or drop off a letter or a written note. Or when you're at the appointment, it's quite possible, like many physicians, certainly in a geriatric clinic or something like that, they would request to speak separately with family or care partners, even about this issue. And the kinds of questions they may ask are: have you been in the car recently? Do you feel the person is unsafe? And as we said, would you feel comfortable with them driving a loved one? And I guess these are the sort of things you might be asked about specifically, and maybe say a bit about some of the red flags or the warning signs that you typically ask about.
Sure. So if you're in the car with somebody and you're experiencing a near miss, so a collision that almost happened, that's something always worthwhile to note in your mind. And keep track of if they're happening with increasing frequency. Like, everybody can have a one-off, right? There's near collisions that happen with cognitively intact people frequently, but if you're noticing hesitation around their driving and coming in close or being in close calls on a consistent basis, definitely document that and keep track of those things. Confusing the gas for the brake, so obviously you want to stop and you press the gas, so you're going even faster, then that's a huge concern. Missing stop signs or stop lights, or not stop or stopping at a green light and being hesitant, those are big red flags as well. Or even sometimes when people are getting more aggressive going through yellow lights when previously they weren't. So you notice a more aggressive pattern to their driving. That's something to note as well. Not observing during lane changes or merging. So you're getting into the lane to get into the highway, but you're not noticing that somebody was in your blind spot or somebody's just to your left or right. That's a big deal. And obviously getting lost. Other things are looking for bumps or scrapes that that might be seen on the car from somebody that might get into accidents while they're driving by themselves in a parking lot. So making note of those things is also really important.
And there's not really one and only one way to assess driving, but this kind of list is one particular sort of attempt at having a bit more of a standard assessment, but there isn't really one standardized driver assessment that all healthcare teams or physicians will use. Yeah. Is that right?
Yes, that makes sense. And it does make it a bit harder to standardize because of the lack of a clear scientific test that you can give. But I think, this was developed by the Champlain Dementia Network, Dr. Frank Molinar, and the Eastern Ontario Geriatrics Program. And it's quite comprehensive. It's shared quite widely in geriatrics training programs throughout Canada. So I think this is a great framework to use so that you're not missing out on things. And obviously this shows the caregiver how complicated this is too. So a lot of times people will feel worried and anxiety about having a conversation about driving, or should they not be driving. And I mean, I think that's why we spend 10 years in school, is to try and sort this stuff out. So I want to emphasize to the caregivers to, this is so complicated. Come get some help with it by people that are trained in it and that do it all of the time. Don't sit there and stew by yourself, as indicated by the 10 various steps here.
And even these are not, cut and dry, as you say. It's not like there's a blood test or a one given test where you're going to say this person is or isn't medically fit to drive. I will say as well, I think there's definitely some people with cognitive concerns who probably avoid going for a medical assessment of their cognitive concerns because of worries about their license being at risk. I think that is a factor for some people in not seeking out help.
I think that's totally fair and honestly completely human, because people do it for their medical illnesses too, right? Some people have more avoidant personality traits, and who wants to hear bad news, or who wants to lose their license? Like, nobody. But it's not something that just impacts you, and that's what we try and emphasize as well, is that the last thing you want to do is get in a car accident and hurt somebody else. Yeah. Heaven forbid.
It is one of those issues across most of the country. There are mandatory reporting requirements for physicians. And, really the report is a medical report that goes to the Ministry of Transportation. And by law, we are actually compelled to do that because it is, in fact, a public health issue. And it is one of those issues where the safety of the public outweighs the privacy and autonomy of the person themselves. So we do, in almost all provinces, have a legal reporting requirement around this issue, which is important to realize that in many cases, as much as we may empathize with the person whose license is, at risk, we also have a duty to the public around this.
That makes sense. It's right. I might have missed. We just, after going through this assessment to just the stating of whether somebody is absolutely not safe to drive, completely looks safe to drive, or is in between.
Yeah. And I guess just before we get to the questions, I think, as you said at the beginning in the introduction, there's the practical side, but there's also just the emotional components around autonomy and identity. And, it's really important that the conversation with the person and with their care partner and family is done in a way that can be supportive and acknowledge that this is, this is an important and not easy for everybody. There's some people where they have no problems hanging up the keys, and but for other people, it is driving may be a really important part of their sense of identity, even if there aren't all the practical things that we talked about before.
Yeah, I think this is it's a great framework. I think this is Dr. Gary Nagley and Dr. Michael Rappaport are responsible for the Canadian Consortium on Neurodegeneration and Aging research group on driving. And so I think this is something that they're really trying to bring to the fray in terms of training healthcare providers, because oftentimes we're good with the first half and, communicating in a legal way what's happening and doing an assessment. But, just as important for the person who's going to experience the loss is putting those things in place. So I love how you've highlighted those things here. And, one thing too, you mentioned is people that are accepting of this. And oftentimes people are aware of the fact that they have cognitive problems, and they know that they're not able to do what they used to. And so that's called having insight or awareness of your deficits. And it's certainly much more challenging when people don't have awareness and they think they're totally fine. Like, hey, I've got no problems. What are you talking about? I've been driving for 40 years. Look at my driving record. And you know that those are going to be the harder conversations to have. And oftentimes when you call the caregiver and then weeks and months after you've sent the notification to the MTO, you'll hear about the conversations that they're having about the mean doctor that took away their license, and they're kind of perseverating on those things. So it's definitely a challenge thing, but I think for caregivers to understand that they might be dealing with somebody that is aware, and you can have conversations one way with those people, but the people that don't have insight, it's a lot more challenging, and you might have to lean on the bad cop healthcare provider to help you out in those situations.
Well, let's dive into some questions, and we're gonna start with a really tough one. This was an excellent question that came in. My husband was diagnosed with young onset frontotemporal dementia at age 57. He's now 59 and adamantly wants to drive all the time. He was our primary driver for the past 36 years. He says if he can't drive, he'll kill himself. How do I get him and know when to stop him from driving? I'm usually in the car with him, and so far his driving skills seem good.
Yeah. This is such a complex question. I'm sorry for the listener or the watcher that's going through this situation. The first thing, we spoke about this before we came on air, is just that it is such a hard thing to go through, that don't feel like you don't need to come up with the answers to all of these questions in terms of are they fit or not. A challenge in particular with usually behavioral variant frontotemporal dementia is that people do lack insight into their deficits. They also have impaired judgment. So they may think that they're safe and they're not safe. They have loss of kind of social decorum and manners and things like that. So they might be less likely to be following the rules of the road when that's taking place. And impulsivity that we'd mentioned before, and the inability to judge risks and benefits appropriately and actually understand they have deficits. So it's one of the dementias that we flag as, even if it's early in the stage, because of the core changes to your ability to weigh pros and cons, certain situations that we might have to take the license away. So I would say go to a healthcare provider, a neurologist, a neuropsychiatrist, a geriatrician, and get an assessment by somebody that's familiar with FTD. And then the second thing is you need support for those threats, right? So teasing out, are they really serious about actively ending their life, or are they using it as an expression of frustration and anger because they're upset about the consequences? And certainly Dr. Levinson can speak more to those things. But
and I think having a supportive environment for the assessment, and this is one of those cases as well where a more in-depth driver assessment may be warranted, especially if the person is, let's say their driving skills are still fine. Just as you were saying, Richard, not everybody who has a mild stage of dementia necessarily is medically unfit to drive. So there's a gray zone, and having a more in-depth assessment rather than just, say, a bedside cognitive assessment may be warranted, whether that's with an occupational therapist or a driving instructor. They have specialized driver assessment centers in every province. The downside to the detailed driver assessment is usually the person has to pay. So it's not usually covered provincially. But if there's any way to appeal to the person's sense of being a responsible driver, I would agree with you entirely, Dr. Stramko. Talking with the neurologist or geriatrician or whoever made the diagnosis, if you have concerns about driving, voice them. But this may be a scenario where somebody needs to have a more formal on-road driver assessment. And probably, even if they are found to be medically fit to drive, the normal recommendation would be ongoing follow-up reassessments every 6 to 9 months to see whether or not things are changing. And that might be an opportunity to have a planned gradual cessation of driving where there can be more supports put in place to help to make it a little less emotionally traumatic for the person. So excellent question, and one that really gets at so many of the challenges in this area. So here's another one. Sorry, go ahead.
That person now will know all of the things to look out for while they're driving with the person that they might not have been noticing before. And so just make sure you keep track of all of these various things we've kind of outlined so that when you go to your appointment, you're prepared.
But I also agree, this shouldn't be your burden to carry. This is something for the healthcare team to work with your spouse and support the family and the spouse in this. So
yeah, bring in the big guns.
And can people with dementia drive a golf cart in a planned elder care community? I guess some of the communities or villages are fairly large, so almost like a vacation resort. They might have small electric vehicles like golf carts.
Yeah, and it's a great question. The same thing applies to kind of motorized scooters for people as well. And I don't think it's a different approach. Obviously, we're not going to revoke somebody's license for a golf cart, but all of the same practical considerations in terms of how's their cognitive functioning, how's their impulse control and their safety awareness, what are the other neurologic disorders, like everything that you do for that, you would do for this, because it's not trivial being hit by a golf cart either. And if you're in an enclosed area, you could seriously injure somebody. And it's the same thing with the motorized scooter as well. Like I've seen people hit other people on these scooters. So I would say go through exactly the same process. If there are any concerns, go to a physician to get this assessment and document all of the potential risks that are happening or behaviors that are happening around driving and try and come to a similar conclusion. It may be, so some people will not be able to drive, and other people that have milder dementias potentially could still drive. And then to your point about the consistent assessment on a regular basis, dementia is a moving target. The brain damage tends to accumulate and get worse over time. So you always need to come back and reassess and see how things are going.
I think you can imagine some gray zones here too, where maybe there's some limitations around it in the early stages, so that somebody might be able to drive between two familiar places during daytime hours that are near to one another, that are entirely familiar, but it might not in poor weather conditions or things like that. So there's again that concept that maybe there are certain limitations or accommodations that would allow the person to continue driving. The risks, while lower for a golf cart in an enclosed area versus driving on a street in traffic, they are lower, but they're not inconsequential. As you said, there's still risks of harm to the person. There's some interesting statistics around the types of accidents that older adults with dementia get into. And I think that's where the public health side, like they're more likely to be the driver in motor vehicle accidents. They're more likely to have medical injuries and disability as a consequence of the action of the accident. They're more likely to be in multi-vehicle accidents. So more likely to have 2 or 3 or more vehicles involved in the accident. And that's part of the reason why there is such a public health concern around people who may be medically unfit to drive. I think the other interesting thing about the assessment and involving the family and the care partners, in one study where 50% of the family, the spouse, said that they thought their the person living with dementia was safe to drive, 50% of those people who later did failed an on-road driver assessment. So even if you do feel like the person is safe, having that more formal sort of professional driver assessment may show otherwise. So another question here, probably the same question as everyone. Other than actually retaking the road test, are there online resources that I can use to regularly check my driving skills? As I age, I'm concerned about specific aspects like reflex time, peripheral vision, and the cognitive processing of complex visual information. Great question.
That's a really good question. I'm not aware of any valid tools, meaning there's tools that you can do to check your memory and thinking, and tools that you can check your vision with online, but I'm not sure of a valid tool where if you test in a consistent way, it predicts any kind of outcome to show if you're not safe to drive. And so I think it's always a question of, if you have concerns as you're aging, to discuss those concerns with your physician, and your physician is qualified in that sense to do the appropriate tests, whether they're cognitive, do a neurologic exam to make sure that your nerves and muscles are working appropriately, test your vision as required, and if potentially other healthcare providers like an eye specialist needs to get involved, can do that. So there's nothing online that I would rely on from a scientific point of view, but maintaining a consistent relationship with your healthcare providers, I think that's the way to go.
I think one of these days we have some excellent researchers at McMaster who are doing a lot of great work on kind of aging, normal aging, and driving. Brenda Verkland is one, and actually I think she just published an article in the CAA magazine. But I agree with you, Rich. There's a lot of interesting work that's being done with driving simulators as well. But I think those are still being used more in a scientific research, experimental kind of way at present, and continuing to study to see, hey, is there a simulator that has the same kind of validity as what we would now call the gold standard, which is an on-road, in-car assessment with a trained occupational therapist driving assessor. And I think there's a lot of progress being made with these kinds of driving simulators, but there's nothing right now that's kind of for public consumption as a way to do a screen to see, are you still able to drive, kind of thing.
Yeah.
One last thing that I just wanted to show people. I wanted to thank everybody. Sorry for our technical glitch at the beginning, but I did just want to, before I thank everybody, this is our iGeriCare site. Please do fill out the survey, which is pinned at the top of the comments section, because we're always looking for new feedback. On the top of our homepage, you'll see the subscribe button. You may be interested in that. That's subscribing to regular weekly emails with content from our multimedia lessons. And it's conveniently located next to the lovely donate button. And I think you know what that's for. That's so we can continue to bring you live online events and updates to our lessons as well. So I want to thank Dr. Stramko for an excellent live event. iGeriCare was developed with support from the Center for Aging and Brain Health Innovation, which is powered by Baycrest, the Geris Center at Hamilton Health Sciences, McMaster University, Hamilton Health Sciences Foundation, the Alzheimer's Society Foundation of Brant, Haldeman, Norfolk, and Hamilton Halton, and our Division of E-Learning Innovation team working safely and remotely during the pandemic. I hope everybody is staying safe during these times. And our next live event is we're planning for December 17th at 1 o'clock Eastern. Topic to be determined. And you can help us determine that topic by filling out the survey and letting us know what is top of mind and of interest for our next live event. So thank you all very much and for your patience as we work through our technical issues. And once again, teamwork makes the dream work. Thanks, Rich. We'll see you in a little bit.
Thanks so
Take
much,
care,
Anthony.
everybody.
Have a good one. Bye now.